Greetings, everyone. Welcome back. Yes, Trap Chat Live was on a hiatus, and I am so excited to be back here in September, the unofficial start of fall, resetting with some very, very important topics. I like to call this my fall reset. We're talking about mindfulness, health, and wellness. And we're going to start off today with part one of a conversation about COVID 19. I'm going to attempt to answer the question: is the pandemic really over? I'm joined today by a prominent national leader and subject matter expert in health equity, minority health, historically marginalized populations, and community engagement, Mr. Cornell P. Wright, MPA. He's recently joined Alliance for Health Generation as the very first Chief Health Equity Officer. Thank you for joining me today. I'm so excited to have you here. If you would like, please provide folks with a much longer introduction. Tell everyone who you are.
No, thank you so much for having me. I thought that was excellent. I don't know if it's just tea that you got in there, but
It is absolutely just hibiscus water, actually.
But no, I'm loving your energy, loving the opportunity to be here. And as you said, I recently have been named the first ever Chief Health Equity Officer for the Alliance for a Healthier Generation, where we do whole child health equity, working with schools and school districts across the country, and then the partners and support systems around those students and those school districts, and it's just an important work. 7 years prior, for the last 7 years before this, here in North Carolina, I served in state government as the executive director of the North Carolina Office of Minority Health and Health Disparities, and that work has always been a part of my very fabric and being. And I ended up in finishing up grad school, did an AmeriCorps fellowship out of that office that I ran eventually later on in life. And so have always had a passion to really jump in and help communities, especially our historically marginalized populations and communities. Yes. And these are the communities that we refer to that have not always been a part of direct resources or opportunities that always they need our help. So glad to be here.
Appreciate you. Thank you. Thank you again. And shout out to my chapter soror and very good friend, Dr. Do Guy, also known as Dr. Kenya Nuru Dennis, who was gracious enough to connect me with Mr. Cornell P. Wright, MPA. I'm going to call you by your whole name from here going forward.
Cornell's fine. You can just call me Cornell.
Okay. Cornell, if you so choose,
or you can call me Mr. Wright if you want to.
Mr. Wright. Okay, I'm gonna go with Mr. Wright for now. But I think we passed that. Anyhow, so you talked about marginalized communities, and I know we're laughing and we're having a good time, but this is a very important topic. And one of the reasons I wanted to do this is because it seems like the pandemic is over for everyone, but marginalized communities. What happened, Cornell? Like, when did we stop talking about COVID?
That's a great question. So I think for probably the past 2 years or so, it's been front page.
Yes.
Every day, constantly. There were trackers, there were dashboards, there, main media news. In the normal news cycle, things don't last that long, unless it's like a scandal or something that's going to capture people's attention. Yeah. But this whole COVID thing just really paralyzed us as a world, not just a nation, but as a world. And so you started to see the rumblings of people once there were vaccines that were out and people were trying to get back to normal life. then we changed our stance on a lot of things. I know for me personally, I still wear my mask out in public because
Absolutely.
I can't afford to get sick. I don't know about you all, but I'm trying to stay away. You know, it's interesting. Um, there are so many things that we didn't know about ourselves until COVID hit, and
Mm,
apparently one of those things is we like to gather. Maybe we didn't say it out loud; we just did it. But you know, I went to a historically black college university for both my degrees, and one thing that was a total change was trying to do a virtual homecoming. Like that didn't
yeah.
work for us. A lot of us that may go and participate in faith communities,
Yes.
now that was interesting and still is interesting because there's some people who still haven't gone back to the building
Mm-hmm.
in terms of their worship experience. And for some
Yeah.
people, it's better. And then for some people, they needed that social interaction every at least once a week, right?
Yeah.
So to answer your question fully, it may have fallen out of the major news cycle in terms of priority, but it's surely not over. And they're rolling out and have rolled out some even new boosters
Yeah, I
to
saw that.
really target Omicron and
Mm-hmm.
its subvariants. So that is something that we're dealing with, as well as dealing with monkeypox and dealing with some other things that we hadn't seen in years.
Polio in the
Yeah.
water and E. coli now in Baltimore's water.
And then there was
Um,
measles in New York, I think. There were some other places having some issues. And yeah, so
yes.
public health is always on the agenda for people that work in public health.
Mm-hmm.
But I don't think it was to the forefront as it was with COVID for most people in everyday life.
Yes. So I want to stay there, but I do want to acknowledge this comment that I just got from LinkedIn. People were in such a hurry to get back to normal. It was easier to just accept it for a lot of folks. Better to convince themselves it's just the flu so they don't have to
Mhm.
change anything about their everyday lives.
Yeah.
Sigh. So and
Yeah.
I love that. You did just mention boosters, so I want to stay there. There was a recent article that came out at the beginning of this month, September 2022. I scanned everything talking about the Omicron booster, and again, we're talking about marginalized communities, our communities, uh, that says that we have the lowest booster vaccination rates. Is that a matter of access? Um, or is that a matter of just what the LinkedIn comment just said that people have just decided that they're done?
It's a mixture.
Okay.
So you can go back to some of the historical um, context that deals with medical history with black and brown folks in this country alone
Mm-hmm.
and see why there is some trepidation at times.
Yes.
There's lack of trust, and it's deeply rooted and warranted. And then you also can look at the newer age of folks, right?
Mm.
You have some newer age folks that just they're going to do their own thing, right? Um, and when you think about this whole notion of getting back to normal, many of us that work in this health space in this health arena, especially in health equity, we didn't want to get back to normal. We wanted to get to better. Um,
I like
and
that.
when we say that, normal didn't always work for us. Normal had us, oppressed, had us poor, had us in bad health, and had us just unfree. And
Mm.
so if we wanted to get somewhere, it's to get to better than where we were. I don't want to go back to where we were as a people. And that's important for us to really think about how do we improve our opportunities, how do we improve our lives, our wealth, and our families, and then what does that generational connection look like that we come together to be better as a people, as a culture, as a community. And so sometimes improving should be our goal instead of going back to normal.
I appreciate you saying that, and I put that comment up because I love it. I'm not as bad as Kimia. I'm sorry, I'm not trying to call you out. One of my favorite people, but I'm not. Like that's something that needs to be on a t-shirt too. We didn't want to get back to normal. We wanted to get to better. So appreciate that. Thank you. I'm going to be using that. Get to better.
Please do.
Yes. You talked about the new people. I like to assume you're talking about a certain age group. I'm going to be
Yes.
presumptuous here. Um, and again, I have to look at the news, even some older news that's still prevalent. So, at the height of it, or when people were still interested in it, as you have so eloquently stated. So about around December 2020, an article came out talking about how COVID had hollowed out an entire generation of Black men. So ages 35 to 44 had like a 9 times greater rate of dying than white people in their same age group. Even then, like 1 out of every 800 African Americans was dying of COVID. Given that what we know, even though we don't see those numbers every day, given that what we know now compared to December 2020, those numbers are probably are a little bit higher. And please correct me if I'm wrong, but from what I understand, more people have died now, up until now than they did when we were, supposedly doing everything that we were supposed to be doing. So, like how do we account for that? How do we reach that important age group, 35 to 44, those people that are most affected in these communities? Like, what do we do?
So that's a heavy one, right? So there's a few things that you got to pull out of this.
Okay.
You said that article was December 2020.
Yes.
We got to realize that the vaccines were like just rolling out,
Okay.
like late December, early January of 2021. So December 2020, January 2021. Prior to that, there was nothing other than wear your mask, physically distance yourself from people,
Yes.
wash your hands, right? Wash your surfaces. So, so once vaccines and then boosters kind of rolled out, it did kind of curb overall deaths and infection rates
Mm-hmm.
for most populations. But you also have to understand too who was at greater risk, and those were our historically marginalized populations, our Black and Brown folks, who may have had jobs that you had to be on site to do.
Yes.
I was blessed, like many of us, where I got exposed to consistently working from home, or as they say, working remotely, right?
Remotely, yes.
And not everybody was afforded that opportunity.
You're
So
right.
here in North Carolina, being so close to the statistics here, our population of Black and African American stands at 22-23% of the population.
Mm-hmm.
Our Hispanic, Latino, Latinx populations are about 9 to 10%. And then our American Indian populations or Native American populations are anywhere between 1 and 3%, depending on how you're looking at the measures from the census.
Okay.
We were seeing the greatest number of infections in our Black, African American, and Hispanic, Latino, Latinx populations. And then our death rates, we saw the highest in our Black African Americans. That was a mirror of what you saw across the country, though.
Yeah.
And so when you have a population that does not identify as the majority, having the majority of cases, that is where we see those inequities or those unfair differences in the numbers, in the gap that you're measuring. Those are the disparities.
Yeah.
And so when you see that comparison, that's where you start to see the problem. So if you've got, and let me break it down to simple numbers, right? If you got 10 people in a population versus 100 people in a population, and then 8 of those 10 people get infected whereas maybe 8 of the 100 people get infected on the other side, the lower number is going to have a worse saturation rate in terms of how that burdens that community of 10 people versus the same number of people that have a larger community being burdened less. So that's what we're basically seeing. And I know that was a very crude way of putting it in simple math terms and numbers,
Yeah.
but that's what we see when our populations that are less populous have higher infection rates and death rates than those that are more populous.
Yeah, and that was that what the information that you just provided, is that the catalyst for you co-creating and co-leading this historically marginalized populations work group?
Definitely.
Yeah. Can you talk a little bit about that? Because I do think it's important. So let me back up a bit. Cornell was able to co-create something called, what did I just call it? Sorry.
Historically marginalized population work group.
Yes. The
HMP.
HMPW.
We just call it HMP work group.
Okay, the HMP work group in North Carolina, and it was because of his rapid response to COVID-19 in North Carolina. So if you can please give us a little bit more information about that, because I do think that your success can help some other people who are, maybe still struggling with what to do.
No, definitely. And I'd be remiss not to mention a few names. So this is the part of the segment where we can name drop some folks.
Absolutely.
E. Benjamin Money, Dr. Michelle Laws, Deborah Farrington, Jeremy Collins, Janet Sullivan, Victor Armstrong, myself, and others. These were Black leaders in state government at our Department of Health and Human Services in North Carolina that came together to really make sure that when we say historically marginalized populations and communities, we're talking about not just how people identify by skin color, race, and ethnicity, but also how you identify in different ways, whether you're from a rural community, whether you're from a disabled community, whether you're, how you identify or how you're identified based on gender and sexual orientation and sexual identification. Those things matter because what we were seeing in the data to be able to make these data informed decisions was that these groups collectively have not always been a part of the process to benefit directly or indirectly all the time from the resources that were distributed or from opportunities that come up. So we started working in communities with the organizations in the community, Black and brown communities especially, to make sure that the money that was coming out from the federal government went straight into the community to help us do this work. And so this network that we've created, we were able to not just put money into organizations that were helping us on the ground, but also bring them to the table so that they had a seat at the table. And with that seat, they had a voice, and that voice mattered. So they were a part of the decision-making here in North Carolina. And it really changes the way we are able to connect with communities in and out of crisis. And so we shouldn't just run to the faith community or run to the barbershops and beauty salons or run to the schools when there's crisis, but we should always have a constant dialogue to make sure that we're helping meet their needs and vice versa. We're having this symbiotic relationship that we depend on each other to survive.
I appreciate that. And that's leading me up to my next question, because just like you mentioned when we first started talking about how some of the things that COVID uncovered for us, one of the things that was uncovered for me working in talent acquisition was the fact that I too have blinders. I mean, we all know that we have blind spots, but the bias that I had towards people who had access, and it wasn't that I was doing that intentionally, but I took for granted until COVID, because I was quick to recognize it and correct it. Like everyone's not going to have a place to do a phone interview, a
Right.
video interview. Everybody's not going to have a home computer. Everybody's not going to have, some people are going to need to use a home phone. Some people are going to have to give me the number to somewhere else. They might have to, like all of those type of things started coming into my mind. And I made it, I was very diligent about ensuring that other recruiters and, hiring managers were a little bit more gracious
Yeah.
when it came to interacting with people. And one of the things that I was excited about, that I'm not so much now, because like many people have said, we've kind of just gotten over it. Like we're not as nice as we were for that year or so. Like we were very kind to one another. We stopped that. That was fun. Now we're going back to normal, so to speak. But I appreciated, again, that more people had access to more jobs.
Yeah.
And that's changed again because we're doing things that are prohibitive. And people aren't going to like it when I say this. I'm not anti-vaccine, but I am anti-vaccine mandate. Especially when you're talking about the people who are the most affected and who are going to be excluded from having access to some roles, sitting behind this, this laptop, if that's the case, or where they're not in a group of people every single day. Like I get why, that's a precaution, but I feel like this what we did in saying that vaccine mandate only, response that we lended ourselves to, I felt like it hurt a lot of people. That it should have been intended to help. Am I totally off base there? Because I'm not an MPH. Like I'm not a public health professional. I'm just looking at it from my lens. So that's wrong.
I think you hit on a few things that are important, right? The mandate itself was problematic for a lot of people, and it's okay to say that now.
Thank you.
I always equate everything to a relationship.
Okay.
Like, I don't know your relationship status, but I'm sure in your life you've been in some type of significant relationship, whether it was with a parental figure.
Oh yeah, I got parents.
Family member.
I got that too.
Significant other. Something.
I got some line sisters. Yeah, I got some friends.
Yeah, so you understand. Perfect example is having sorority sisters, right?
Okay.
You don't get along with everybody. You love them. You love most of them. Maybe.
I get along with them.
Right, but not everybody's personality is gonna mesh. Is what
right. Not all the time. Correct.
So what we failed to realize in this space, in terms of addressing some of these public health concerns, was there's a difference between moving with speed versus moving with equity, and we always got to make sure that we are considering everyone else's experiences in the process. So later on in the process, we started to pivot and do it more correctly in terms of having different standards for people who did not want to be vaccinated. And I think now more so than probably when it originally happened, if we would have had some of those pieces in place to start with, we probably would have been better off in terms of people not feeling forced to get vaccinated.
Yeah.
I think in a lot of cases, it was dictated upon not having the vaccines readily available when we were seeing so much death. So to kind of curb that, there were decisions made to make stuff mandatory. Whereas I think with hindsight being 2020, I think we probably would have changed that approach in a lot of cases, and you just had like the measures of uh, unvaccinated people doing more testing more readily, so they could still feel that freedom and autonomy of their body, as
Yeah.
opposed to feeling like that they had no control of their medical decisions and practices.
I appreciate you saying that. That is probably one of the most it's probably one of the best explanations that I've heard for it. And you said it in a just a soft way, and a, by virtue of what you do for a living. I wish that I had heard you say that earlier on, and then I could have shared it with more people, so that they had knew that someone understood and someone was listening.
Can I jump in right there, because I
Of
think what
course.
you just said was so important, right? To bring the point home, we've got to do better as public health practitioners and those who carry the message of public health practitioners to
Mm,
say it in our voice, right? When we have things that are being shared in our communities, we don't always say it with medical jargon, right?
yeah.
If you go to we'll go back to faith communities as an example. If you go to a faith community and engage in a service, and then you leave that service, and somebody said, "Well, what did you learn today in that service?" You're going to put it in your own language,
Hmm.
and it's not always going to sound like the person who brought the message. It's going to say, "Oh yeah, he said be kind to everybody," right? Not quoting all the scriptures. You may have written them down, but you may have highlighted in your Bible or whatever.
Yeah.
But you don't always say it the same way somebody else said it.
Hmm.
We've got to figure out in the public health world and beyond, as we're sharing, how do we get to the different communities in the way that they take on messaging, right? There are so many, evidence-based strategies and approaches that talk about this. I've done it myself, in different ways of bringing public health messages to people using hip hop.
Yeah.
I did a keynote one time where I had a DJ and a spoken word artist as a part of my presentation,
Yes.
and mixed, songs and lyrics, and literally had music playing throughout the whole thing to really connect back to a broader audience. And that form is, coined as edutainment, right? But
Hmm.
you're entertaining and educating at the same time, and people really respond to that. And we've got to really make it okay for people like us to talk to people that look like us in a way that they listen to us.
Yes. Who say that again? We have to.
We have to make it okay
We have to make it okay
for people like us
for people like us
to talk to people that look like us,
to talk to people who look like us,
to be able to receive a message the way that they will receive it.
to be able to receive a message in the way that they are able to receive it. I get a gold star for today. Uh, so we are coming up on 2:30, and I know that I don't want to. I want to have some fun. I think we have been having fun, but I want to have
Yes.
pure fun. Uh,
Okay.
Pure fun now, and I want to talk about some things that are trap chat ish. So you just talked about hip hop. So you're a hip hop fan.
I am. I'm a hip hop fan. I'm a musician. I'm a music
Oh,
producer.
what?
Yeah, I help work with. I got a great friend that I went to college with. Her
Hmm.
name is Sharice Malachi.
Okay,
She did a lot of work at our alma mater, which is North Carolina Central University. Go
yeah,
Eagles!
go Eagles.
Uh, and she would bring hip hop summits to the campus to expose students to opportunities in the world of entertainment. Um,
Nice.
I worked with her on that. We also had some artists and residents like
Mm,
Ninth Wonder, who's a hip hop producer who went to North Carolina Central University from
okay.
North Carolina. We also had Christopher Play Martin from Kid and Play. as a part of those initiatives as well. So yeah, I love hip hop. I love music. I'm a church musician every Sunday at my church. So
My mother is about to send you a LinkedIn and a Facebook friend request. I don't know if you know. So little known fact outside of so Kimia. I told you Kimia introduced us, and Kimia and I went to undergrad together at University of Richmond. And at the
Go
time,
Spiders.
I was the director of the gospel choir, and she was the assistant director. And then when I graduated, she was the director of the Umoja Gospel Choir. Shout out
Awesome.
Umoja. Shout out everybody. My mother just sent me a private message that says yes. So you got a new friend. Please accept her. Okay. Accept my mother.
Let her know I play multiple instruments. My main instrument is percussion, so the drums.
You play the drums?
There's a running joke at my church where they were like, "Oh, he's a drummer," and anybody that knows me will turn around and say, "No, he is a percussionist."
Okay.
There's a difference.
I got you. So I'm going to ask you this question because I'm excited now. I'm very excited, and you could give me a hip hop song and or a gospel hymn, church song, spiritual
I'm ready
song,
for both.
Whatever. I would prefer both, but I'm trying to be nice to my guests today, even though it's you. When you need to get that, you need to get yourself motivated, or you need to get yourself ready for work. What is that song that you push play and say, I'm ready?
Can I give you 2 hip hop songs?
Absolutely.
Okay. One of my favorite songs ever, hip hop related, is Proceed 2 by The Roots, featuring Roy Ayers. You got to get that version.
Okay.
It's the more jazzier version, but is excellent.
Okay.
And I put it on a playlist. My wife and I have this playlist now. It started out as her playlist, and then I took over and put some of my songs on there.
Gotcha.
But that song came on as we were driving to Richmond over the weekend, and she was like, "Oh, I love this song," and I was like, "Oh, I've converted her."
Good. Okay.
But to get my mind right, like if I'm about to go do a presentation and I'm getting dressed and just jumped out the shower, putting the bow tie on and all that, I play Hola Ovito by Jay-Z.
Okay.
That is my jam, and I put it on repeat.
Okay.
I am a Jay-Z head, like nobody's business, but that has got to be probably one of my favorite songs. And most people don't know that one just by the name, but he's got this lyric that like is so. I mean, the whole thing is awesome. But
you have to do it. You have to rap it.
When he says, "And with the third pick, I made the earth sick. MJ, him J, fade away, perfect." Oh,
woo!
Yeah, I get real hype. Like I can take over the world after that. Now, gospel.
I heard that. Yeah.
Gospel. This is going to sound crazy to some people. I am a huge Kirk Franklin fan.
Oh, okay.
And I am a huge Richard Smallwood fan.
Woo!
And there are 2 songs.
Restraining order against my mother. I think it expires in 2 years. No, I'm teasing her.
It's 2 songs though.
Okay.
That most people. So the first song is "Total Praise" by Richard Smallwood.
Yes.
And if you ever hear the testimony of how the mental state he was in of loss and almost depression, when he made that and those words came to him, it's just an amazing testimony. Yes. But there's a song by Kirk Franklin called "Don't Cry." And
wipe your eyes.
Yeah. Yes.
He's not dead. Yeah, I'll be laid out if you start singing.
Yes. So here's what most people don't know. Richard Smallwood is playing piano on that song.
Oh, I didn't know that.
Yeah. So it's like one of the few songs that's like the best of both worlds. Like I love Kirk Franklin's writing and arranging.
Yes.
And then that mixture with him and Richard Smallwood doing it together, I will play that song on repeat. And my wife is like, "You going through something, huh?"
Richard Smallwood has gotten me through a lot of days. Like
Yes.
I talk to my mother all the time, but we talk about music, and I tell her something. I said, I feel like I've forgotten more songs than most people know, because she's always had me, involved in sacred music.
Right.
She'll tell you that we would come home from a concert, and she would hear a song, and I was a little girl, like small, and she would want to remember, because back then they said cheap music, like we weren't recording on phones or anything like that. She's like, "Oh, I remember that song," and she said I would just sing it. But I can't sing, so don't ask me to. But
now, I'm gonna give you another like honorable mention though.
Okay.
As much as I love Kirk Franklin and Richard,
Yeah,
Hezekiah Walker's up there with me too.
I used to follow him around Philadelphia anytime. I was Kojic whenever he came to the fall convocation. Yes, absolutely. That's my favorite gospel art. That's my favorite gospel artist. Yes.
His catalog is unmatched.
Absolutely.
Like outside of the two I mentioned.
Yes.
Like,
so what's your favorite song?
From From Hezekiah?
One? Yeah.
There's so many.
Okay.
If I'm in a fast mood, Jesus is my help.
Okay.
If I'm in a slower, God of a Second Chance.
Oh wow, you're saying that.
Yeah. So, and I'm probably doing such a disservice to some of the other ones I love.
Yeah.
I think it was a total different temperature too. When his ex-wife was singing some of the
Moni.
Yes.
Yes. My nemesis. Yeah. Yes. Like I said, I was a small child, but I wasn't that small then. But I was a kid, and yes, enamored by him, like just in awe of his music.
I mean, but then you got other people like, going deeper, like Milton Brunson.
Absolutely.
Timothy Wright.
Absolutely.
I mean, you go real old school to like James Cleveland.
Okay.
I actually have a voice.
Pringle?
Oh, come on now.
Feels now, like
fire. You go back to like the late 80s to like Take Six and Commissioned, which brought you Fred Hammond.
Fred Hammond, yes.
I do I won't do it here, but I do a funny voice impersonation.
Of Fred Hammond?
No, James Cleveland.
Oh, we'll have to do that off. We'll have to get that offline.
But I call him. Like I say, well, I guess I could do it. I'm like, yeah, this brother JC, yeah. That deep, sultry voice, and I will do it on the phone for people, and it's just so funny because they can't stop laughing. But
do you shush them? Because you have to shush them. Yes. If you don't shush them, then you have not done a proper James Cleveland.
Peace be still.
Listen, I don't know how this turned into service, but that always seems to happen whenever I get someone who shares my my like of gospel music on it. So I'm sorry, y'all that have no idea.
Don't apologize for being.
No, I'm talking about the people that have no idea what we're talking about.
They'll be all right. They can look it up.
Google it. Yeah, so just Google it. It'll make sense.
They might get delivered.
Yes, that's one of my favorite people too. I find him quite entertaining.
He is very, very hilarious.
All right, so another question I'd like to ask my guests for the career-minded people out there: what's the best piece of career advice that you never took?
I'm gonna skirt around this question and start it off. I'm gonna get back to it.
Okay. So what's the best piece of advice that you did take?
Well, I'm not even gonna tell you that.
Oh,
I'm gonna tell you what I did.
Jeez. Okay.
I did tell somebody one time, my good friend Alicia Barfield, she calls me the little brother she never asked for. I told her she was preparing for like a panel interview, like not like a job interview, but like a panel discussion.
Okay.
And I told her, I said, make the questions your own. So literally, that's what I'm doing right now, making the questions my own.
Okay.
Here's something I did on this job that I just got that I had never done.
Okay.
I was so confident in the conversation because it's about stuff I do daily. The work of equity is a part of my life. It's a lifestyle for me.
Mm-hmm.
It's not something I pick up and put down at the end of the day. But I gave the panel interview, I gave them homework. Yeah. In the middle of my interview responses, at the end, when they asked if you have questions, I gave them homework. And the question I asked them is a question that we ask people when we interview.
Okay.
It's usually the last question we ask. And there's no right or wrong answer per se, but it helps gauge mindset, especially for the communities that we work in. And it's why are people poor? And do you know, right? Do you know the people on that panel reached back out to me and answered that question for me?
Oh, wow.
And when I talk to my coworkers now, some of them that were on that panel, they were like, we had never experienced that. And that really set you apart from everybody else. Like you knew your stuff. You were confident. You took time to answer each question. You had examples that were relevant to the position. And you gave us homework.
Yes. So that's great career advice. Give them homework.
Now, back to your second question of
my first question.
No, I'm working backwards.
Oh, okay.
The second question about the best career advice. I don't know about what I've heard and used per se, but this is something I used to tell people all the time. There's an HR algorithm in most places. So if you're filling out an application, as opposed to just having your CV or your resume, make sure that application wording fits the posting wording.
Yes.
Meaning that you're not lying, but you're making sure that the words align and match. Because that algorithm that comes up is going to look for those key words. And so when you do that, you have a better chance of at least making it through the screening process, if nothing else.
Well.
Now, the worst piece of advice that I've ever gotten was to be yourself. And I don't think this is like the worst advice. It's just you can't be so much of yourself that you're too comfortable. So you have to gauge the balance between being able to connect with your audience, but not being so comfortable that it throws them off. Correct. And I've seen it backfire. I've been in an interview where people had like gum in their mouth and they took it out in the middle of the interview. I've had people that I've had to do virtual interviews with that didn't know that I could hear them
chewing.
No, they were like struggling to get on video chat and having a moment and using some different language. But I didn't hold it against them because I know how frustrating some of that could be. So like when you were talking about having grace, I think that's some of the best advice. And I think it's important for people like us to be in the room to share those experiences. Even on the job I have now, we've had some conversations about centering equity in the decisions we make and how what I do from my shared experiences may look different from what other people that don't look like me would do. And kind of bringing that up and being able to be brave to do that. And creating brave spaces is so important.
I love that. So last question I have for you. Before we went live, we were talking about grits. Okay. And it's a wonderful food. Yes, the food grits. So we're going to just get it out of the way. Does sugar go in grits?
No.
You heard it here.
So
live from a North Carolina native.
Sugar
does not go in grits.
To put it like the biblical context states, when I was a child, I spoke like a child. And then to paraphrase, when I grew up, I put away them
childish
things.
things.
So when I was younger, I used to put sugar on everything.
Oh.
Sugar water, sugar
Oh.
milk, sugar grits, right? But I grew up.
Okay.
And my grits are way more savory now.
Yes.
Butter, cheddar cheese, sharp
Yes.
cheddar cheese,
Yes.
some crumbled up bacon.
Yeah.
Maybe some onions.
No. Now
Maybe
you don't know.
you got to use the green onions, more
I'm
like
very childish. I don't like onions. I'm very
Oh,
childish.
okay. Yeah, but I mean that's if you're trying to be fancy. But like
Okay.
basically for me, I'm good with some grits, butter,
Yes.
crumbled up bacon, and sharp cheddar cheese, and black pepper.
Yes.
I'm good.
Shout out to Savory Grits. I have truly enjoyed our conversation. We could have gone on and on and on and on till the break of dawn.
Good one.
I can do it too. Before I let you close things out and tell everyone what's coming up for you and all that, I do want you guys to know that this is a dynamic person. He did not know me when he accepted my invitation. Like I said, a great friend of both of ours reached out to him and asked him to come and talk to everyone and to kick off this very important month for me. But even not knowing that, I don't know, our energy connected some kind of way. Like we've only communicated via email. This is the first time we've actually, been on camera together. But I had to tell everybody what he did to me when he first came on. So he gets in, and he's in the waiting room. I bring him on live to the broadcast, and he's like going like this, like he's listening to music, and I'm like, "Can you hear me? Can you hear me? Like you're on mute." And he's like, looking back this way, and I'm like, "Hello, hello, hello." And it was like, he waited till I got to the point of frustration, before I cursed. And said, I'm like getting ready to type in the comment, like maybe leave and come back, or check your browser. Are you connected? And he starts laughing because he played a little trick on me, and I knew right then that this was going to be a very exciting show, and I appreciate it. I appreciate you disarming me in that way, because I am going to be honest, I was a little bit intimidated given your credentials. No, I mean, because this is, like I said, this is an important topic. I didn't want to come across as too pedestrian. I wanted to give you the opportunity to speak about it and to offer some insight to the audience. And then we achieved all of that, and much of that is because of the tone that you set, which put me in a great frame of mind. So I appreciate you, and I thank you, and I'm going to continue to call on you, both live and on Memorex. Ooh, I did it again. All right, so tell everyone, where they can reach out to you, what's coming up next, and what they should be thinking about in terms of COVID.
Well, thank you for having me. This has been amazing. I'm gonna switch the order up a little bit. For COVID,
Yes.
we definitely are hoping that people can start their regimen.
Okay.
If you've only got one shot or no shots, like please consider going and getting protected and getting vaccinated. If you are in that regimen already, pick up where you left off, or get your boosters. And then there's also a new booster out. So educate yourselves and others about what that does. And if you need help, we definitely can share that information
Yes,
and
please.
help walk you through some of that, or help you talk to people in your community that you trust, in case you don't know us. But we can help walk you through the people that are trusted sources that can help you make informed decisions, and also talk to your medical professionals if you have them. Not everybody has that opportunity, and so we always don't want to assume that everybody is connected that way, or not. So if you do have that privilege, please take advantage of medical professionals that you do trust, that may know more about your medical situation than any of us could ever tell you. But it is important to be protected. And if you're wearing your mask still, make sure you wear it properly. Cover your nose and your mouth at the same time, and be careful out there. We don't want you socially distancing. We want you to be connected socially, but physically distance if you need to, and make sure you're washing your hands and your surfaces. Those things are, things that we can live by every day. But in terms of what's next, a lot of things are next. But I'll highlight one here in North Carolina.
Okay.
I'm a featured speaker for the North Carolina Public Health Association Fall Education Conference down in Wilmington. And I have a title for my presentation is First in Flight, Stop Trying to Fly Unbuilt Planes and Calling It Equity, where we're diving into the fast versus equitable approaches and responses that we have in our public health systems and beyond. Okay. And then in my new role, if you really want to help into the work that we're doing here, you can go on our website, which is healthiergeneration.org. And there's so many ways you can connect to the work that we're doing. There's also online resources there. So that's healthiergeneration.org. And you can also donate, or you can, get a part of the resources that we have to share. Or if you're looking for a career opportunity, go down to the bottom of the website and click on where it says careers. And we have some open opportunities right now.
Are they only in North Carolina, or are they remote as well?
So no, we're a virtual organization that is a national. We're a national organization, and our founding organizations are the Clinton Foundation and the American Heart Association. Okay. So we cover all 50 states. We have people that are in 29 of the 50 states. Our top 4 states currently are North Carolina, Oregon, California, and Texas. But we have representation currently in 29 different states. And then some of the positions may be state-based. So you might have to be in a certain state or a certain area of that state. But for the most part, the world is the oyster working in this organization. And it's been really good. One of the bigger things that I'm tasked to do is work on behalf of our JEDI work. And that's justice, equity, diversity, and inclusion.
Yes. I love that. JEDI. Yes.
Yeah, that really drew me to the organization, is that this nonprofit is forward thinking enough to really include the justice component to the equity, diversity, and inclusion work that's going on. And that makes a huge difference, especially with dealing with people that need help the most.
Yes. I'm going to add JEDI to my lexicon. All right. I appreciate you so much. Thank you for joining us. Everyone, please come back tomorrow for part 2 of this conversation. There's still so much to unpack. I tried to stay on the public health side with this conversation, but tomorrow I have Dr. Bernard Ashby, who's going to be giving a little bit more of the practical medicinal information. And then next week, we're continuing with health and wellness. We'll be talking about mindfulness with Alicia Ramsdell. Then the following week, the 21st, we will have a trainer extraordinaire, Jamal Piper of Piper Professional Training, who will be we'll be auctioning off a 30-minute session with him. I'll be putting some details up on that. And then we're going to close out the month with another dear friend of mine, Dr. Darrell Williams, who will be talking about your finances, your healthy finances, and how that's connected to, every other part of you, your spirituality, your finances, all that being connected. So September is a great month, a great opportunity for us to get together, learn some things, and as Cornell said, socially connect with a purpose, and that purpose being to learn more, to share more, and to grow together. So please come back tomorrow, and then come back next Wednesday. But I'll remind you again tomorrow. So see you guys next time. Have a good one. Bye-bye.